Stroke or Bell's palsy? That is the question. And this is a situation where a patient can present to you with stroke and you can mistakenly identify or diagnose a patient with the Bell's palsy or the other way around. So it is important to understand how to diagnose a patient and differentiate between the Bell's palsy and stroke. The idea is very simple. You ask the patient to wrinkle their forehead. If a patient comes to you with the uh, okay, so I'm starting again. Okay, guys, so this is Mobeen. We're talking about differentiating between the stroke and the Bell's palsy. So if a patient comes to you and says, one side of my face is feeling like rubber, or it is stiff, or I can't move my face properly, or I have pain in my ears, or I have ringing in my ears, or I cannot chew properly, or I'm having a problem with the taste, or I am not able to keep the saliva in my mouth and I'm drooling. So many of these issues can lead you to think that the patient may have Bell's palsy or may have stroke. So this is really important for us to understand if the patient is having a stroke so that we can very quickly help the patient, bring them to emergency and reduce the damage that can occur if they are experiencing a stroke. So this is actually for all of us healthcare professionals and for laymen as well. So if a patient feels that one side of the face is having a problem, you ask them to wrinkle their forehead. If they can wrinkle both sides of the forehead correctly, then they are having a stroke. However, if they are not able to wrinkle the side of the forehead on the side where the face also, the rest of the face also has some effect, then you can think that this is Bell's palsy. So that is a concept and it can save lives if you know this concept and if you can apply it. Today what we'll be doing is we'll explain why this, what is the mechanism behind this. So let's start. We will draw a face and a facial nerve and we'll connect it to the patient's brain, and then we'll talk about the lesions or damage to various parts and see what kind of response on face will be observed. So let's say we have this patient here or this person here, and he comes to you and he complains that one side of his face, so let's say that this is the right side. Let's say that this is the right side and this is the left side. So he is complaining that right side of his face he is having a problem there. So this is where he is having a problem. Your duty is to figure out, and the problem he's saying is something that is making you alert. He's saying that hey, he's not able to move his face on this side and so on. So what you got to figure out is if it is a Bell's palsy or if the patient is experiencing a stroke. If it is a stroke, you got to quickly send the patient to emergency or call the 911. So what will you do? You'll ask him to wrinkle the forehead. If he can wrinkle both sides of the forehead correctly, you would immediately start going towards the calling the emergency and supporting. The question is why. So let's talk about that. So here we have a copy of this person's picture, and what we'll do is we'll make the brain over here. So let's say this is one side of his brain, right brain, and this is the other side of his brain. So this is right brain and this is left brain. Now what happens is that the right brain sends the motor fibers down that relay in the pons in the facial nerve nucleus, dorsal facial nerve nucleus, and then the facial nerve brings the fibers to the same side on the upper part of the face and to the other side on the upper part of the face. So what you have to take away here is both sides of the forehead or upper part of the face are supplied by the right side of the brain here. Then on the left side, we have a similar situation. Left side fibers come in, they relay in the pons in the dorsal nucleus for the facial nerve, and then they supply on the same side and they supply on the other side. So can I say then that the forehead from the right side is supplied on the same side and on the opposite side, plus forehead on both sides is also supplied by the left side. So let's make blue for the left side. So left side is also going to be supplied on the same side and on the other side. So left side is blue and the right side in our diagram is. The other thing to keep in mind is that the right side fibers will also go down to the lower part of the face and supply that as well. So this is important. Similarly, left side fibers that have crossed over, these fibers will also go to the lower half and supply the lower half of the face. So what does that mean? So keep in mind, lower half is only supplied by one side. For example, the left side of this person is only supplied by the right side of the brain, and the right side of the lower part of the face of this person is only supplied by the left side. This side of the right side of the lower part of the face is supplied by the left side of the brain. And this side, of course, is supplied by the right side. Now let us take this diagram and see if we can create a lesion. Before that, one more concept here that is important, and that concept is that this is from here down, this is the facial nerve. Similarly, from here down, this is the facial nerve. So here we have the same person, and now let's do this. Let us make a lesion here on the right side of the hemisphere. Let's make it in red. So here is a lesion. So there is a stroke patient has experienced. That stroke has caused the patient to have a problem on the right side hemisphere. So this is the lesion and this is a stroke. Now think carefully. When the upper motor neuron is damaged, the fiber that is going down, this one, this fiber is going to come down and then supply both sides of the forehead. So ideally, both sides of the forehead should stop working. However, because the left side is also supplying both sides of the forehead, both sides of the forehead will be okay and patient will be able to wrinkle both sides of the forehead. On the other hand, if you notice this, the fibers from the right side that are coming down, afterwards when they enter the facial nerve, they come down and they supply the left side of the face, this side. So in case of stroke, because the right side fibers are damaged, the pathway is damaged here, do you think that the lower part of the left side of the face, that is this side, will it have the nerve supply? or signals? No. Why? Because left side is not sending any fibers over here. So what is the situation then? In the case of stroke, patient can wrinkle both sides of the upper part of the face, or work with the upper part of the face, wrinkle the forehead, but the lower part is not. So this is the situation which is stroke. So you ask the patient to wrinkle the forehead, and if the patient is able to, you immediately call emergency. Don't say, oh man, looks like you're fine, you could wrinkle the forehead, you're fine, go home. Don't do that. Now let's see, if it is a lower motor neuron lesion, that is the facial nerve itself is damaged, then what happens? So let's say now you're seeing the same patient, but this time we are going to create a lesion on the facial nerve over here. So here is the lesion. This is the area of the lesion. So how did this lesion come about? Many reasons. For example, Lyme disease can do that. For example, a pregnant woman, when she retains fluids, those fluids would cause the facial nerve or the surrounding tissue and or the surrounding tissues to swell up. Facial nerve can get trapped in the fallopian canal, and that entrapment can cause the facial nerve to have compression effects and essentially cause Bell's palsy. Similarly, there are viruses like herpes zoster and so on. These viruses can cause this. Remember, normally we say that if we do not know the reason, that is when it is Bell's palsy. If we know the reason for the lesion, then it is not the Bell's palsy, it is that reason. Okay, so again, the point is something else here. We want to understand what will happen when the facial nerve or the lower motor neurons are affected. So the effect in this case is here. Maybe the facial nerve is trapped in the fallopian canal. It should be a little lower near the ears. So now when the facial nerve is affected in this area, what do you think? Will the fibers from the right side go down to the forehead? No. Will the fiber from the left side go down to the forehead, these fibers? No. Will they go to the forehead on the left side, here, from the left fibers? Yes. So this area will be intact for the left. Do you think that the left side of the face will be intact? Yes. However, because the right side facial nerve on the right side has become affected, all of the face is affected because neither the right hemisphere nor the left hemisphere is able to send the fibers to the forehead or to the lower part of the face because the nerve itself has become damaged. So that is the quick discussion for how to differentiate between the stroke and Bell's palsy.